Okay, so good morning, everyone. Today, I'm talking about epilepsy and COVID-19. Initially, I was told that this is a journal club, and I'll try to make it as more of a journal club format as possible, so that everyone will enjoy and will try to analyze certain papers related to COVID-19, especially in epilepsy aspect. So I'll start with going through some of the recent publications. The first one is about seizures and COVID-19. Can COVID-19 cause seizure? So what happened is that initially we are very uncertain, but we know that not many patients in Malaysia are actually having seizures when they were diagnosed with COVID-19. Most of them are having respiratory symptoms, but subsequently people found that some of them has a neurological symptom as well, but not exactly seizures. However, we have no papers initially until this paper came out on 304 patients, and of which 1/3 of them has severe conditions in the and then however, the good news is none of the patients in this cohort had seizures or status epilepticus, as we can see here. So this is a rather epidemiological study. It analyzed a cohort. There is no comparison, there's no randomized, there is no treatment per se, but it answers a very important questions. So my first key point is a simple, straightforward study, sometimes very essential in critical time like this, especially for students and people who are doing research. And you know, a lot of times you doesn't have to go into a high-tech research to answer a very difficult genetics or technological questions, but we can go to a simple study methods to answer very important clinical questions. So how about indirect? So indirectly, some people will talk about seizures aggravated by fever, especially certain childhood epilepsy. And sometimes someone are stressful, their seizures may become more frequent. We are in the process of collecting data on this, although this is believed to be true, but stress-related seizures are not always proven. And the third one is about missing medications or reducing their dose because they cannot get enough supply. This happened in some of our patients as well, and we are also in the process of collecting data in Malaysia. So when we come back to that brief communications on the seizures, the same paper, we try to analyze how they managed to collect so many cases within a short period of time. If you look at the dates, they collect the data from January 18 to February 18, which is just a month. But they are getting the information from 42 hospitals in Hubei province, which is in China. And there is the epicenter in that province. And in addition, they also get information from Sichuan and Chongqing, which is very close to Wuhan, Wuhan city. So the other things they are trying to do is they are collecting the data mainly from electronic medical records in reviewing all the informations related to patients. It's not a prospective design, it's more of retrospective design, but it is the most important thing is it answer key questions on seizures and status epilepticus among people with COVID-19. So this is how they classified mild, moderate, severe, and critical, and this will be a benchmark that has been used by many other subsequent studies later on how we classify COVID into mild, moderate, severe, and critical. The next paper is from French, which is published in New England Journal. It's also studied within a month, from March 3 to April 3. But this is not only on epilepsy, it's mainly on neurological features, which is a broader category than just epilepsy and seizures alone. And you can see that there are only 58 patients, but all of them has very severe COVID-19 infections. The age are rather old, which is the medians are 62, and these are their findings. One of the important things that we want to bring out or want to discuss from this paper is not only the brain MRI. As you can see that the brain MRI are almost 62%, but not everyone are having MRI. You can see that there are about 13 of them having MRI when they are diagnosed to have neurological disorders. And 62% has MRI changes in the leptomeningeal area. Leptomeningeals are the meninges that covering the brain parenchyma. And some of them, in fact, have strokes, was diagnosed to have strokes. And recently in our cohorts or in Malaysia, from our stroke friends, they are talking about strokes in COVID-19 as well in Malaysia, although there is no paper or no publications on this. Another important questions about CNS infections of COVID-19 is to find the positive PCR in the CSF. However, in this paper, 7 of them has lumbar puncture done. CSF didn't show, all of them, 100%. CSF didn't show any positive PCR of COVID-19. But yet, just remember, there are oligoclonal band, there are immunoglobulin noted in the CSF, which can be a response to the immune phase rather than the initial infective phase, suggesting that the brain involvement in COVID-19 are likely secondary, not because of direct virus infections, but because of the immune response due to the COVID-19, but we need more information on this. And because of that, the IRAE tried to come out with a consensus statements on issue related to COVID-19 and epilepsy. And we know that many of these, we still yet to find evidence. For example, do people with epilepsy have a higher risk of COVID-19 infections? We have no evidence. We are unsure, but most of the epilepsy patients are young, and there are some older patients as well. But in terms of risk, it seems to be comparable, but no evidence to suggest they are higher. Second question, are people with epilepsy at increased risk for complications from COVID-19? The issue is about immune system. If someone have impaired immune system, they have a higher risk. And who are the epilepsy patients with impaired immune system? In fact, not many. Most epilepsy patients, their immunity or immunity will be the same as general populations, but for a specific subgroup of patients who need steroid treatment, who need immune therapy, for example, autoimmune epilepsy, then they may be on higher risk, but this only form a very small percentage of people with epilepsy. The next question is, do any epilepsy or seizure medications increase the risk of COVID-19 or complication of COVID-19? This we need further information, although the statement say there's no evidence, but we know that medications for epilepsy may interact, which I'll explain later, with COVID-19 treatment. The next question is, can seizures get worse or more frequent if someone with epilepsy is infected with COVID-19? So far, there is only low risk of seizures that may get worse if they become infected, partly because of fever, partly because of sleep deprived, partly because of stress. But directly, there isn't a clear-cut answer or evidence to it, and we are in the process of collecting data in Malaysia. So what happened? The next is the supply of anti-epileptic drugs, and these are something important to look into. In Asia, which is slightly different in terms of cultural, social belief from the Western country, whereby Asians' compliance to medications may or may not be affected by their beliefs. And because of that, we found that some of our patients, they don't receive their medications. They have no supply. And some of them are afraid to come to hospital to collect their medications, and they cut down their dose. And therefore, many hospitals are supplying or trying to find ways to supply the medication through delivery or drive-through medication collections. But we are yet to know whether this will really help or which most of the patients, or this only help on a small percentage of the patients. The other concerns are about emergency department review, and many patients are afraid to go to emergency. And in fact, many of the seizures doesn't need emergency treatment. And this is also a statement by ILAE, but how much the impact of the afraid to go to emergency department will affect the seizure severity and control is yet to be answered. Another problem of our current practice is that any patients who required investigations has also been affected by the service, partly because MRI machines are the slot for MRI machines are reduced to accommodate or to avoid the contamination of the MRI machines. But EEG has been continued, but the numbers has been reduced as well. This happened not only in my center, but in many hospitals in Malaysia, partly because if there is a contamination of any of these machines, the machine need to be sanitized and disinfected to be used subsequently. So this is the collections of information that I mentioned just now. If someone have seizure and on anti-epileptic drugs, as well as they are diagnosed to be COVID and treated with COVID therapy, there are certain drug-drug interactions to be noticed. And the University of Liverpool has published a very well chart, and they keep updating the chart whenever there is a new COVID treatment. As you can see, the red color indicate that they are highly likely to have drug-drug interactions. And the left columns are all the anti-epileptic drugs. The top row are the COVID-19 treatments. For example, these are the antiviral. This is the chloroquine or hydroxychloroquines. And this is the interferon or tocilizumab, which is the immunotherapy for COVID-19. And you can see the red column occur mainly for the antiviral as well as the chloroquines. And the anti-epileptic drugs involved are mostly the enzyme inducer, include carbamazepine, phenobarbital, phenytoin, primidone, and these are the old medications, the old generations of anti-epileptic drugs. The newer one has actually less drug-drug interactions, as shown in the green color, as well as some in the orange color, which have less intense drug-drug interactions. The next one will be a new paper on psychological distress. This is very interesting because the study was performed within a very short period of time. Let me go to the design first and come back to the results later. So if you see the design is an online questionnaire design, which they use WeChat in China. And then the key thing is, can we have informed consent in online questionnaire? Which we can. In fact, they have done that using a consent form on the online questionnaires. And they only use a very simple psychological distress scale, which has only 6 items. And these 6 items are divided with Likert scales of 0 to 4, and therefore the total is 24. And any severe distress is any score more than more than 12, sorry, the 22 is the reference. So any score more than 12 are considered severe, and they perform it in the patient as well as age match and sex match control. If you look at the number are not very big. They only collect about 100, 200 patients as compared to the controls, but they found, and they didn't report the means. You can see the reports are mainly on the medians of the score. And you may thought, hey, 1 and 1 doesn't differ very much, but because they are having a different range, this is the median, but some of them are scoring 2 or more, and that's why there are statistical significance for these non-parametric comparisons. Secondly, the severe patients, there are about 13% of them who were diagnosed, who were found to have a score more than 12 in epilepsy group as compared to 1.6% in the healthy controls. And these are the key issues. There are patients having nervousness, hopelessness, restless, some are depressed, and some have a problem to find energy or to have a lot of stress, things that everything need an effort. This is a rather simple online WeChat study that we thought we can do it as quick as similar in Malaysia, but the impact of doing it in China is different from another country. So nowadays, if we are doing it in a very severely affected country, for example, Indonesia, Bangladesh, or in Africa, or in India, then this will give a different results, and the distress will be much more greater, and it will even be useful for comparison's sake. So in summary, I will go back to the key questions that Farouk has asked me. He said that today I'm not only to present a few papers and discuss their methods and results, but also try to find or to suggest what are the potential research that we can do. So before I can present this, I would think that I will need to know your background first. Can you all unmute yourself or show in the chat that what is your background, so that I know what are the things to focus later on the research potential.
So, Prof. Lim, if I can talk on their behalf, we have a mixture of HDR students. So many of them are from psychology. They are doing a lot of psychological research. And we have a lot of students which are lab-based. So they are doing experimental neurology, epilepsy, or
animals, genetics.
Yeah, animals, genetics, and many are also from non-epilepsy field, but they are interested in COVID, so that's why they also join today's talk.
Okay. So my second question is, there any one of you have already started a research related to COVID-19? Anyone or any projects related to COVID-19?
Hello.
So, yeah, who's that?
I am Dr. Karen Golden. So, I had a project ongoing, and now it is being modified with the COVID situation. So it is just we're just about to get the new data for the parents of children and with autism and without autism. And I'm looking into doing other types of groups of children, maybe with epilepsy or cerebral palsy.
Yes. So can I say that you are a psychologist?
Yes, clinical psych, yeah.
Yes, psychology study are relatively important. So for children to be confined at home, how can they cope, especially those with autism and the hyperactivity or learning disability is also another concern. So yeah, right, yes.
Yeah. So
how about
else?
Others? Anyone else? Yes.
Hi, Prof. Thank you so much for your talk. I'm Vinod here. So we are interested in SARS-CoV-2 or COVID. So we are actually in the process of doing some work, with collaborators. So we mainly look at the viral proteins and how they interact with host proteins, and possibility of therapeutic window there. And we are also looking at distribution of ACE2 receptors in neuronal cell lines or in neurons per se, and the capability of COVID actually causing neuronal anomalies, because there are reports saying that in severe patients that there are a lot of neurological symptoms being observed. So that is some of the proteins we are interested in, some of the work, sorry, we are interested in.
Yes, so it's rather clinical as well as laboratory based, huh?
Yes, Prof.
Yes.
Yeah.
You, Prof.
Prof. Lim, we also actually, we have developed a project with the Australian colleague, and this is something which is very different, which is on health misinformation, because we have observed on social media there were a lot of health misinformation, especially related to COVID. So with AI and other stuff, actually, we are actually trying to do some of that project.
Yes. Health information is also another key issue. In fact, a lot of times we don't have a good way to talk to the public, and we depends a lot on our DG in Malaysia, and a lot of other things are from mass media and news. Some of the news or informations in the mass media may not be correct or maybe misleading, and some informations we are also gauging whether we are giving too much information or too little in reducing the stress of people, especially the public. So I'll come back to the research potential first, and then after that we have a Q&A, then we can discuss some of these topics further. So the key point is, who are our targets? Are we talking about COVID patients? Are we talking about the severe COVID patients? Are we talking about the public? These three key areas has three ways of research or understanding their problems. Some people also look into the family of COVID-19 as well as healthcare workers, especially the work stress and the depression and anxiety among the healthcare workers as well. So, and some people look into a specific subgroups, as what we heard just now, on children, on parents, and on certain patients who are confined, and especially the one that I'm doing is on people with epilepsy. So when we define our study populations, that's easier to discuss further, whether we are looking at their medical aspect in related to their treatments, their presentations, their psychological concern, or their neurological manifestations in some of these papers, and as well in the Dr. Uday's project. Some are looking into a non-human components. They are looking into the biological components of the human and non-human states, either animal or genetic studies. And one of the important study now, which I recently found one in Europe, is to study the percentage of seroconversion in the populations. Because if we can have, or if we can determine the seroconversions of the population, we can determine the prevalence, the severity, the mortality in a more definite or confirmed way. So in Malaysia, we know that when we first started to have COVID-19, some people are talking about rapid tests. They are doing IgM, IgG testings, but we know that these are not a good test for diagnosis. However, screening the population or specific group with IgM and IgG will help us to know how many seroconverted patients are in the populations, because some of them are asymptomatic, some of them are missed, some of them have not even have a COVID-19 check, and the seroconversion rate will help us to know. So this is another key project, not only in Malaysia, but also in a lot of China and European countries. they are doing the zero conversions to determine the population prevalence. Another important area which is easily doable through online questionnaires, as I mentioned in the China paper, is another hot topic. How stressful are we? Not only the patients, not only the healthcare workers, not only people with epilepsy, not only the children. How about the publics? How about the specific group? And these are rather essential to see how patient or general public cope with the problem and how they subsequently overcome it, and how great or severe the impact of psychology of COVID on the psychological aspect in the person. So I have a friend who is a psychiatrist. He has done a very simple study on his son, which I thought is very interesting. So he asked his son, "Can you give me one word related to COVID-19?" And his son answered, "Dangerous." So this actually helped to analyze how most people perceive COVID-19 and how people deal with or cope with COVID-19. Are there mostly negative comments, or are there any positive comments or positive words come out from COVID-19? These are something very useful to know. As we know, COVID-19 are not always bad. They have some good outcome. For example, the air pollution has improved. This is one of the aspects that we are looking into. So in terms of public, if you are economists inside, if there are any socio-economic group in this talk, then one of the key things is to look at the economic impact of COVID-19 on the general populations. Why are we reduce the confine or the control of the MCO in Malaysia? Does it have any economic impact or not? This will be one of the important issues, and people are calculating how much loss per day, per MCO day in the world as well as in each country economics. These are very essential, especially to the policymakers. So people are also looking into legal issues, whether we should sue someone causing or the spread of COVID-19 without proper protections. Are they suable? Are there someone who has caused a legal issue, and should they be fined guilty of spreading COVID-19? Are there any legal concerns to the COVID-19? These are another aspect or research that the legal team are looking into. And other things related to medical side, especially to the severe COVID-19, which are more important for us as a medical doctors, is to know the epidemiological patterns, the management, especially a lot of clinical trials are now ongoing in determining the effect of COVID-19, as well as how effective is the prevention of COVID-19 in the communities. And the last is information. As Farid mentioned, the collaboration with Australia. Myself think that information distributions to the public need to be studied as well, to know what informations are in fact causing more stress and what informations are in fact helpful and needed by the public, or what are the informations that publics are actually looking at. In fact, I have friends who have stopped reading news because they are so afraid to read the numbers increasing every day in the initial stage. They are just seeing, oh, so many people die, so many people got infected, so many positive cases, and this can cause a severe stress, and some have actually stopped reading news because of that. So in the Birmingham Universities, these are very useful informations they have published, not only to patients, but also to the clinicians in various ways, and these are two of the various informations that have published. And one of the key questions that we ask, for example, if you are tested negative, but you are in contact with someone with COVID-19, for example, you are exposed to a positive case and you were tested negative initially, shall you do a retest? So the Birmingham has added information on this. So this information will be useful for general public if they are looking for information like this, specific but yet relevant to the public. The last is just the advertisements of our coming public talks on epilepsy awareness, and I will talk on the COVID-19 to the general public. And if you are students or if you are happy to help people with epilepsy or want to know them, feel free to join us on 17 May, and the details you can get from Dr. Farouk. Thank you very much. So now is a Q&A sessions, and I'm happy to take any questions from you.
Okay, thank you so much, Prof. Lim. Wonderful talk. Anyone who want to ask question, I think either you can raise your hand in the bar. If you see in your participant, if you click on participant, then you will have option of raising your hand. You can raise your hand, then I will actually, or you can unmute or directly ask question, or you can also put in the chat box if you would like to. So now
I hope I'm not too fast.
No, I think probably it was okay.
So what are the informations that you are collaborating with the Australians? What are the projects about?
So the project is about the misinformation. So they are applying some artificial intelligence and logarithms to actually understand. The main objective is actually how this misinformation can be prevented early on. So before it spread, how if you can develop an AI system which can detect and then prevent before it get viral. So something on that. So I think the AI team actually have a lot of job to do, but before that the health team will be finding out the correct information and giving that information to them. Yeah. And also the one other important aspect, the reason the both Malaysia and Australia actually coming into that, because we want to see how the developed nation and undeveloping nation, what is the difference, because Asian and the Western, that's another interesting perspective which we want to look into.
Yeah, for comparison, huh?
Yeah. So is there anyone, any question? If you can raise your hand, then or you can unmute and ask question to Prof. Lim. This is the chance to interact with him.
Hi, Karen.
Hey, Karen, go ahead.
Not a question. I just wanted to say thank you very much. I found the talk very interesting, informative.
Thank you.
Hello, Dr. Lim.
Hi, Dr. Day.
Hi, I'm Uday from
Yeah.
Canada. I just have one concern about COVID-19 and epilepsy patient. The symptoms in COVID-19 is it has a respiratory distress in patients. So because of respiratory distress, a patient feels low oxygen supply to the major organs of the body, and will that affect the hypoxia condition in the patient, and it might trigger the epilepsy for those who are not having epilepsy, not having the seizures, but are on the medication. So will that thing affect the patient? And I'm just concerned about of getting the data in that perspective, like the respiratory distress might cause the trigger for epilepsy.
Yes, indirect impact, huh? So are you a neurologist?
No. I've completed my PhD from Monash.
Ah,
And I'm working as a, preclinical research scientist in Montreal.
I see. Wow. In Canada.
But my research completely focus on epilepsy. So it's
Yes.
about
So you're right that there are people talking about indirect impact, but because of the indirect impact, we don't group them under epilepsy alone, but we talk about neurological deficits and presentations. So what you can read from the paper I showed just now on the neurological manifestation, in fact, many patients have severe COVID-19 because of various reasons, including firstly, hypoxia, secondly, viremia, or thirdly, the immunological response to the virus infections has impact on the brain itself. So the impact is in various site. It can be in the meninges. That's why they cause leptomeningeal enhancements. It can be in the vessels. That's why some of them develop stroke. It can be in the parenchyma, and that's why some of them develop cognitive impairments. They have upper motor neuron features, which is the features of brain damage when they were examined, and some of them develop cognitive impairment after recovery, which means that some of the patients after recovery, they have these agitations, behavioral, psychological, as well as cognitive sequelae of the infections. And some people also talk about direct nerve damage. And one of the common symptoms is anosmia. Anosmia means you can't smell. And the reason why it is so is because the olfactory nerve, the nerve for the smell, is so close to the nose, so close to the nasopharyngeal space. When the virus are there, they may directly damage the nerve and impair the smelling functions of a person. And as a consequence of all these various type of damage, seizure can happen. But seizure is not a direct consequence of COVID-19. It's rather indirect.
All right. Thanks, Prof. Lim. Can we take question from Christy?
Yes, Christy.
Yes, thank you so much for your talk, Prof. Lim. And I just want to share that I also was involved in an international study, but I'm a social psychologist. So we were looking at the public perception of information, which is also related to what Dr. Farooq was doing. So our study is an international collaboration, and we wanted to see how information was phrased and how that affects the public compliance with the directives. For example, during this time of MCO, how much do people comply with staying home, keeping a 1 meter distance, etc., and whether that affects their pro-social behaviors during this time as well. So compliance is quite an important, I think, topic during this COVID-19 time, whether people actually listen to authorities and institutional directives. And I just wanted to ask from your perspective, does the COVID-19 time affect how patients comply with their doctor's instructions, for example? Because now information is so widespread. Maybe, for example, they need to go into the clinic to get their medication, but maybe from conflicting information, all of a sudden they're afraid, and would that impact their health in that sense? Thank you.
Yes, of course. So if you first understand how the hospital react to COVID-19 is, firstly, all the admissions in major hospital, especially hospital with COVID-19 patients, has been reduced. Second, the emergency department has also been very strict of who and should come and who shouldn't. And therefore, many patients has reduced their emergency visit if they can avoid it. And thirdly, the GP are also afraid. So even a GP, they may not be open all the time, and there may be some restrictions for patients to visit them in the clinics. And the fourth is definitely the key issue, as you mentioned, whether they can get enough supply of their medications, or whether they are afraid of coming to the hospital to collect their medications. And the last one is regarding the informations and telehealth. So what happened in Malaysia is that our telehealth act is very old, and it doesn't say we can or cannot communicate with patients. So telecommunication between patient and doctors are in a gray zone. How much we can communicate through telecommunications like phones, email, are not clearly stated in the legal act. So many patients have no contact to their doctors, and many patients have difficulty to get further information if they don't meet the doctor physically. Okay, so this occur, and this is actually worse in the government hospital, but the private are also affected because of COVID-19. So you are right, the informations that disseminate to the patients will somehow affect the patients in their compliance, the key questions that you are asking. And the compliance is not only compliance to the general rules of social distancing, wearing masks, and so on, but also compliance to their medical advice. So for example, in epilepsy patients, as the one that I'm doing now, is we are trying to understand how patients comply, or what are the key problems they face, and how are these key logistic problems affect them in medical seizure control, as well as psychologically, their anxiety, depressions, and quality of life.
All right. Is there any other question anyone want to ask? You can unmute and ask. So, Prof. Lim, I have two questions. The first thing is you mentioned about the anti-epileptic drugs and the interaction with COVID-19 drugs. So the epileptic patient who are on first generation or second generation anti-epileptics, if they are getting COVID, are they, neurologists, are they moving them to the newer drugs, or how is their treatment adjustment?
So far, I don't have any epilepsy patients diagnosed with COVID that I come across. But from the recommendations, any interactions need to be considered. So giving you an example for people with retrovirus or HIV, when they are on antiviral treatment for the HIV, and they are also on medication for seizure control. These are things that we usually do. Firstly, if the seizure are relatively good control, we will reduce their medications to reduce the impact of drug-drug interactions. If they are not, then we will try to switch to the newer medications, which has less or no drug-drug interactions gradually. A lot of these change occur gradually, but because HIV is rather a chronic problem. But in COVID-19, then the story is different. We may need to change, or may need to switch the medication to another one, right, in a rapid manner. But because patients are in the hospitals, there are always emergency rescue regime to help, just in case when they switch and their seizures become more, or they develop status epilepticus, there are always an emergency actions to deal with this problem.
All right, thank you so much, Prof. I have a second question, which is regarding SUDEP. Those who don't know SUDEP is sudden unexpected death in epilepsy. So how much is the risk of SUDEP in patient with epilepsy when they have COVID, because of the common respiratory issue in there?
So we are asking ourselves about two questions first before answering this. The first question is, what are the predisposing factor for SUDEP, which is sudden death in epilepsy, which occur in patients usually at night without any warning sign, and they was found dead the next morning. So most often it occur in patients with very refractory seizure, which means their seizures are not controlled. If someone's seizures are controlled, so that risk is actually very small. In general, the risk is 1 in 1,000 patients with epilepsy that can die every year. But when we come to respiratory questions or respiratory infections like COVID-19, we will need to answer the second questions, which is what is the mechanism of SUDEP? What is the likely explanation why people die suddenly at night without any warning? So there are many theories, and the theories came mainly from the heart. Respiratory is not the theory that people are concerned because someone develops seizure and they stop breathing. Most often they only stop for about 1 minute, they resume their breathing after that, and it shouldn't cause death. But the heart arrhythmias, the heart conductions may be affected during sleep, during a seizure, or because of the medications that may cause SUDEP. So related to the heart problem, there are two likely reasons. Firstly is seizures occur at night, and the seizure itself affect the heart. The second is the medication itself has changed the heart mechanism or the conductions of the heart, which may cause SUDEP. So in related to COVID-19 and respiratory problem, first of all, anyone with severe respiratory, they are ventilated, or even if they are not ventilated, they are monitored in ICU, which is intensive care units. And any arrhythmias or any heart rhythms will be monitored. So the chance of develop sudden death without an explanation is less likely. But directly related to the respiratory distress causing death, we usually don't call them SUDEP because it's not unexpected, it's expected.
All right, thank you so much. Is there any question, any other question?
Yes, Karen.
I am curious if there's any initial data or concern about what might be the impact on the neurological development of children who were exposed, like whether they were exposed during the late phase of their mother's pregnancy or in early infancy. Like, might it affect their neurological development? Might it increase seizure, like epilepsy rates? Any initial thoughts that we might see something later on?
You mean young children who develop seizures, or young children
like
who are
how
learning
might the
disabled?
COVID impact the child? Yeah, what might be the impact on COVID in the developing neurological system? Or like even if the parents, like there's cases internationally where the mother is giving birth positive, she is positive with COVID and the child is positive, or might we see like what happens in COVID infection during second trimester or something, first trimester?
Yes. First of all, I haven't seen any paper on COVID-19 in pregnancy. And secondly, if a pregnant mother develop COVID, we are still too early to answer any questions related to their child, because perhaps they may or haven't delivered the baby yet. Even if they have delivered, we will still need to wait and see what happens subsequently. However, deliver baby of a normal mother during COVID period is an issue, but this is, I'll leave it to the obstetricians to answer this, partly because there are many delivery now during COVID period, and there are a lot of precautions and worried, but I have not seen anyone of pregnancy and have COVID-19 infection at the same time.
Okay, thank you.
Is there any more question? This is the last chance to ask. If no, then we'll end the session. Thank you so much, Prof. Lim, for your valuable time and a wonderful presentation and talk. We really learn a lot from this, and I hope we managed to get you in MCO, but I do not know post MCO whether again we'll be able to catch you. So thank you so much for your time, and thanks everyone for attending and making it a great success. Thank you so much.